Hello, Alex. This is Alex Caruso of Alessandro Caruso Architects. Alex is the managing director and principal architect. Is that right of the practice, Alex? And also a REBA client advisor. Is that right as well?
That's correct. And
Lovely.
hello, Nick, and thank you for having me on your show.
Yeah, thank you. Thank you for coming on. This is episode 24, so I thank you for joining us. And yeah, please tell our audience about the practice and your history and who you are, please.
Thank you, Rick. I formed the practice back in 2014,
Okay.
following a period of experience over in the UK. I relocated in the UK back in 2001,
Okay.
and over that period between 2001 and 2014, I did the bulk of my experience working from with other practices. In one of them, I managed to enter at architectural assistant level
Okay.
and exiting as an equity partner after before forming my own practice. This was a very important period of my time in the UK to form my experience, but ultimately my goal and my dream remained to form my practice, which I co-founded with my wife Amelia,
Okay.
and we have uh, the aim of the practice was to specialize in well-being design.
Okay.
I had experienced a motorbike accident uh, back in the late years of my university time in Palermo. And so I've had the fortune, what I call is a fortune, of being able to associate my skills as an architect to the perspective of a patient in a healthcare setting. And that I found that was the most important and formative part of my personal development,
Yep.
but also my ultimate goal for the practice, specializing in that sector. So we do the majority of our workload is healthcare related, either for the NHS or private healthcare operators. But also we do apply the same principle to particularly interested clients across the education sector, special educational needs, or where mental health is of a specific concern.
Okay.
In the commercial sector, because sometimes we overlook that our well-being starts way before we arrive in an healthcare setting. So I like to think that what we can do in a residential sector, in a commercial sector, or in education sector, way before we arrive in an healthcare setting, is as important. They say that the majority of our behavior that ultimately may lead to any form of healthcare issue starts way before we manifest
Okay.
the symptoms of it.
Okay. And well, looking at your portfolio of projects, we've obviously shared some of your work already. You've worked on a variety of schemes, all sizes, all budgets, from I think it's from 50,000 to 30 million, haven't you? So some in the main, are they mainly healthcare projects that you've worked on?
The majority of it are healthcare projects. 75 to 80% are healthcare projects.
Okay.
And in within the healthcare, we like to think that we offer a specific, more niche type of interests. We work with the acute sector
Okay.
and the diagnostic sector. But also we work in the mental health and dementia sector. And so they are all sector within the sector that have got some nuances that needs to be taken on board when it comes to design. Um,
And So you mentioned as well, sorry, you mentioned the NHS obviously, but also are you some of your work takes place in Spain, Italy as well. So is this still the case now? You're still practicing overseas as well, is that right?
It's very limited the amount that we do overseas. It's the main work that we do overseas is for clients that I have left before I uh, moved to the UK,
Okay,
and they are affectionate clients. Most of our clients inevitably end up becoming
of
friends,
course. Yeah,
and the practice has got a fantastic record of long-term relationships, and which we care to keep in that way because sometimes the building are the result of a very successful personal
absolutely.
relationship with our clients.
Yes.
And I have always made a priority of listening the client, but the client and the users of the building that the clients bring to us. So sometimes we may have a relationship with the estate managers, but the estate managers have got a fantastic array of stakeholders to satisfy, from a clinical team to all the way to the patients
Yep.
and the carers of the patients. So we make the most of try and create opportunities for as many touch points to understand what the aspirations are of all the stakeholders using what we use pre-start surveys that are backed with post-occupancy surveys so that we know whether we have captured the aspirations and whether the aspirations are delivered on the ultimate result of the building.
Brilliant. And so the projects you're involved in, you mentioned you've been going, the business has been established since 2014, so what, 11 years or so now. How you mentioned it was you and your wife, you're both co-founders and partners of the business. How else is the business made up? Is there more staff involved in the work that you do, or do you outsource things? How is the business model?
Yes, so the business model is my wife and I generally look after the management of the practice with the support of Andrea, our practice administrator, that and who supports us in any activities associated to the administrative side of the
Yeah.
practice. I lead all the projects in the practice thanks to the support of architects, architectural assistants, interior designer, and senior technologists that come and work with us. Generally, we have a core team with which support us, and then we try and outsource any additional requirements depending on the inevitable peak and
Of
troughs
course.
that are, shall we say, a characteristic of our business.
Absolutely. So talking of the business now then, what do you have in terms of pipeline? What are you working on at the moment that you're particularly proud of?
Well, we have recently won our third award, international award, for one of our latest care home design.
Yes. Yeah.
This care home design is part of a much wider vision for a care village that we have done for our client, Millennium Care. And the beauty of this development is that is in a area densely vegetated, and we like to think that daylight, nature are the most important ingredient
Yes.
for any
Yeah.
well-being, and we try and bring those qualities in on any of our projects. So as part of these projects, we were able to integrate within a very difficult and challenging terrain formation and introduce our building as one of the shall we say, retaining wall,
Hmm.
and then so that we could give to the building a, shall we say, subservient volume.
Yes.
And then we introduced some terraces that enhanced the opportunities for the residents to immerse themselves in the landscape,
Okay.
uh, either because they could use the parapet wall of the terrace, which had an integrated raised planters that they could interact with to for potting activities, but also we introduced some birds watch huts that really were part of a local community interest. So the local community can be invited as part of the use of the building. It was one of the things that came out of the stakeholder public consultation before the planning approval
Okay.
was introduced. Other things that we got on that we are approaching the completion of the first community diagnostic center that has been designed in the UK, and we were proud to be part of. Again, is a project that has achieved another international award, and that in its final form has reflected very much the original concept, which was based on the harmonic tissue ultrasound imaging
Okay.
curve, and because the curve is associated to the detection of life, and it was a fantastic concept to associate to this project. So we are very pleased with the way it is looking, and very eager to start to hear the stakeholders' feedback as soon as they come in the start using the building. And then we have an array of other projects that are either at early stages of feasibility study. We are about to start a new care home, which is in the early stages of development, but also we are doing a supported living accommodation for Hey Mind, which is for people with mental health that are going through a rehabilitative process. So it's another interesting way to integrate in the community people that may have had issues associated with mental health, and they are going through the model of care to step back in the community. So it's a real
And
variety.
all of these are, do I assume they're all over the UK? Geographically, anywhere in the UK, ultimately, because your reputation precedes itself. I presume they're anywhere in across the country.
Yeah, we work from London area and beyond. The furthest away that we have done south is a place called Fishbourne, where one of our latest care homes for again is a mental health rehabilitative environment was completed for one of our clients, all the way to the other side of the M62, where we are based in Beverly, but we do quite a lot in Manchester area. We are one of our early feasibilities in
Yeah.
Huddersfield. We are currently doing a care home in the early stages for a care home in Bristol. So it's a real variety of places. We are about to start a GP practice down in Hedingham. So we cover all corners of England,
Yes.
if you like, England and Wales.
Well, it's nice to hear that there is you have a great deal of pipeline of work. Um, And you mentioned peaks and troughs, but it sounds like you're going through a very busy period at the moment, which is great to hear. Um, so, what are the plans of the future of the business then? How do you foresee the next 5 and 10 years going for the practice?
Yeah, we will continue to work within our areas of specialization. And we like to think that we are on a growth path.
Hmm.
We have been for the last 11 or so years, and we want to continue to grow. But our growth path is an organic growth path.
Okay.
We are particularly keen to grow with the development of our members of the team. We are only as strong as the team that
Absolutely.
supports us.
Yes.
And the team that we have within the practice are all members that have gone through the process of an apprenticeship, and that I've personally been able to mentor through the process,
Okay.
and they have modeled their way of working with the way I would work, and it becomes all a natural way of progressing. They have been an active part on our certification for our ISO 9001, ISO 14001, and ISO 45001, respectively, quality, covering quality elements of the practice, the sustainability elements of the practice, and the health and safety element of the practice. And they are all the three aspects for me as critical for the growth. So the reason why we invested so heavily, despite the team being around about 10,
Hmm.
is because I believe that if the systems and processes are strong and used correctly, we can be as efficient as a team of hundreds.
Absolutely.
And that's how we like to think that we can facilitate a growth that is not too aggressive, and allows uh, the time for members of the team to gently bedding themselves within the practice, and make of our way of working their way of working,
Yes.
and thereby allowing the practice to grow.
Well, it sounds like you have the business model exactly as you want it to be, and it sounds like clearly it's working very well. And all credit to the work that you do. Um, so, with regard, we've spoken about it's obviously in the main healthcare, which came about because of your accident when you were younger in the 90s, 30 years ago or so. Um, we touched on some residential projects you've done historically. Do you still work on any residential schemes at all, or is that only if it presents itself?
Good. One of the most exciting scheme that we are currently working is a major master plan that is for a mixed development, which combines residential, commercial, leisure,
Okay.
and a number of uses. And residential is part of that. And
Yes.
well, I do follow closely, and part of being part of the group that meets around Salus Healthy City conference,
Hmm.
and we are trying to bed in the parts of this master plan all the elements that make what I have been able to learn working in the healthcare setting, applying it to a master plan that should promote well-being and health way before we arrive to an healthcare setting, which is essentially what I was referring to
Yes.
earlier.
Yes.
Because if I believe that if we live all our life in a setting that is facilitating us how we access the nature, how we expose ourselves to daylight, how we have our priority needs addressed
Mm.
in the design, chances are that the need that we may have, independently from which is the our social condition,
Mm.
it will ultimately limit the need to arrive to a healthcare setting. One of the things that we often uh, work on is health inequalities. I'm supporting Hull University and the course of Pedro Alvarez, Beltran Alvarez, for the course on health and sustainability. And within that course, what I
Yeah.
like is that we can work on that multidisciplinary input required to make the life of people well, way before we arrive to having to address the health inequalities that inevitably happen in any of the realities of around the globe.
Yes. Yeah. Well, you have it's fascinating that I could listen to you all day because you have formed your business around, I mean, we spoke before we started, but around something that was an accident that happened to you that could have been so dreadfully terrible that you turned completely on its face to give you the the will and the want to change people's lives. So you turned a very what could be deemed as a negative event and a dreadful accident into something hugely positive. And you're able to spend the next 3 decades working to help others, which is all credit to you.
Well, it is indeed that's one of the things I've learned from that experience is that the difference between pain and suffering. And we all can experience pain, and certainly through the accents, I had my good fair share of it.
Yeah, I can imagine. Yeah.
But the suffering is completely different because whilst the pain can happen, the suffering only depends on how we react to the pain. And if we see any pain as an opportunity to explore how we could react to it, it can become an extremely positive experience.
Yes. Yeah.
I have covered in my book, which is Design and Meditation, the principle of it, because as a result of the accident, I ended up exploring how I could use yoga and meditation
Yeah.
to offset the medical treatment that I was undergoing as an anti-inflammatory, which ultimately resulted in an ulcerated stomach. And I realized that I could not rely only on medication, and I therefore I approached yoga and meditation. The yoga and the meditation became for me the most significant alchemical process
Mm.
to instigate the transformation that is required to start with myself and how I see everything that happened in my life, but also to apply that to other people
Yeah.
because that sensitivity that happened to ourselves can help us see what other people need.
Yes.
And that is where what has driven the mission for the practice.
That's fantastic. Yeah, and it's so many people have benefit and will continue to benefit from the work that you're doing for hundreds of years to come. So that's really nice to see, and something hugely positive has come from what could have deemed, and others may deem a negative thing that's happened to you. So that's really good to hear. I'm a huge ambassador of trying to turn things positively from some from a negative situation that's happened. So yeah, that's brilliant. And some of the work that you've done that I've seen that you've shared with me and continue to share with us to promote in the magazine is fabulous. And I look forward to continuing to share your work and having our audience and the readers of Architecture Vogue see more of what you do. It's fabulous, honestly. And it's um, well, look, thank you for talking to us about the work that you do, the practice. It's fascinating. We could talk all day. The work that you do and been involved in is fabulous, and I really thank you for coming on and speaking with us today, and allowing us to share your work with our audience and talking about the work that you do. I really do appreciate it. So thank you.
It's been my pleasure, Nick, and thanks for having me. For me, if there is one thing that I can say is it's been humbling to help so many people uh, go through their healing journey,
Yes,
and I'm really pleased to be part of your platform
thank you.
to continue to spread that message.
Very kind. Well, let's if we can if we can help even one person with the work that you do in any way, shape, or form, then our job is done, as far as I'm concerned.
Indeed, I would agree.